episode is brought to you by Support the Mountain's Herbal Parasite Cleanse. This formula targets the small and large intestinal tracts and larvae, the most broad-spectrum formula available today. 100% organic, formulated by Dr. Mikio Sankey, author of the Esoteric Acupuncture series. For 10% off your first bottle, visit shopyogahub.com and use the coupon code CLEANSE at checkout. Hello and welcome to YHTV's Magical Medical Tour. Thank you for joining us today. I'm Christina Suzuma, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman.
Hello, Christina, and greetings, everybody. Welcome to Magical Medical Tour. I'm Dr. Glenn Woolman. I will be your medical guide along with Christina today as we travel through another quadrant of the healthcare galaxy to search for optimal health. And we're kind of going into a prior quadrant. We've been here before. Our guest today is Kabir Southwick, who's a naturopath and an Ayurvedic healthcare practitioner and an herbalist. So we're going to be talking with him today about home remedies. How's that sound to you, Christina?
I love it. I love home remedies, as you very well know. Now, I just want to tell our audience that at any time during the show, if you have a question or a comment, just simply scroll down on your screen and type it into the comment box and be sure to click submit. Or you can pick up the phone and leave us a message at 818-LETS-TALK, 818-LETS-TALK. And we'll be sure to get your question or comment over to our special guest or Dr. Woolman and reply to you. So be sure to leave your contact information back for us as well. There we go, Glenn. We're on our way.
Thank you. We are on our way. Also, people, even if you're watching it or listening to it, not at the time that we promote it, but at any time, you can get back to us. So we'll always be looking for your comments and questions. I did want to be clear for a moment. I know that a lot of people that are on the internet these days will look for things and come across things on their searches for special words. So I wanted to make sure people today that are tuning in for the first time, we're not going to be talking about solar panels or changing light bulbs for more efficiency or insulating your attic. This is we're not going to be remedies for the home. This is actually going to be remedies for people that live in the home. So without further ado, all of you that have been watching Magical Medical Tour for a long time probably know Kabir Southwick. He does practice Ayurvedic medicine, and he is an herbalist and a naturopath, and he's done many shows with us. So rather than introducing him in different ways, I would just suggest that all of you go back and look at some of his other shows. He always brings out great information for us and practical aspects of healing. Welcome, Kabir.
Oh, thank you. Thanks for having me, Glenn. Christina, it's good to be back again.
Yay.
Yeah, you're our returning champion.
Back in the saddle again.
Back in the
saddle.
And I'll keep bouncing.
So, Kabir, today we're picking home remedies, and we want to first describe what that is. I think home remedies have been around probably even before there were homes, would be my guess. People have been using things to take care of themselves long before there were actual physicians. And then basically, I think one of the reasons that people use home remedies today is because of the expense of going to a doctor, the difficulty making an appointment and having to wait for things. And then when you actually do get the medication, sometimes there are many side effects. So people are always looking for more holistic ways of taking care of themselves and treating themselves with more common things. And that's what we're going to approach today. But I do want to say, and I may say this along the way, and probably you will say the same thing, Kabir, that's very important that this usually be done. First of all, you should have a knowledge of your own body. So if something is wrong and you're not sure what it is, it might be better to actually see a doctor and find out what it is before you start treating a symptom. But if you do have an idea of symptoms and you know that it's not serious where you would need to be in an emergency department or a hospital or at the doctor's office, then that might be the time to go for it. And I would also say that if you have some kind of a symptom, I'm sure we're going to go over many common symptoms that people have, and I'll bring this up again later possibly, is that if you continuously have a symptom, even if the home remedy is working to get rid of that symptom, it's my belief that you probably should get it checked out rather than continuing to count on the home remedy. And once you find out what it is, and if the home remedy is still okay, continue. But there might be something that it's disguising because it might be so effective in that moment that you'll feel better, but that doesn't mean the problem is gone or cured. So with that, what's your thoughts on home remedies in general, Kabir?
Yeah, those are all good points there, Glenn. And yes, many of these home remedies are really not what we would say cures, addressing the root cause, but sometimes just helping to soothe over certain symptoms. For example, acne, there's many home remedies which I'll cover, but constipation could be the actual cause. So it's important to understand that a lot of these home remedies are not cures and they could require much more treatments, which could be done at home, like a colon cleansing or a liver detoxification or changes in your diet, changes in your lifestyle, and other factors would be very important. My second point is I'd like to make about home remedies, and they are very, of course, I think, like you said, since the beginning of time, I think humans have always tried to come up with simple natural cures that they had available to them. And what makes home remedies different than other types of herbal remedies is that you're utilizing what you have at your in a home, spices and foods and vinegar and oils and other substances which you would have available without having to be an herbalist, which in a sense makes them kind of limited because of certain conditions. I just don't know of good home remedies for certain conditions because I only think in terms of the herbal formula or the herbs which I know work. So, and then in Ayurveda, if we're talking Ayurvedic home remedies, then there's generally at least 3 for every condition because there's usually the Vata condition, the Pitta condition, and the Kapha condition. Best example would be a type of arthritic pain. A Vata type of pain would be dry and cracking, so you'd want to use something that's moist, like castor oil packs. And then Kapha type of arthritis would be painful, but more swelling and a more dull pain. So a ginger poultice would be very effective. And then there's type of inflammatory or Pitta type of arthritic pain, which has more heat along with the pain. And there we can use, say, aloe vera with turmeric, which is more anti-inflammatory and cooling. So you have the same condition, but you actually have 3 different approaches based on the type of body type or really the type of condition. You can have, like I mentioned, Kapha arthritis, Vata arthritis, and Pitta arthritis. So it's much more sophisticated than just here's the home remedy for the condition. So I'll cover some of the variations, but that's really quite complex and a little more time consuming. So I'll throw out some of them, but it's important to keep in mind that just because I mention or you read about a home remedy, it may not be the right home remedy for your body type and your condition, the type of ailment or acute condition that you have.
Will you be able to focus at all today on home remedies that are general for everybody, or will you stay within the realm of Ayurveda and Vata, Pitta, and Kapha?
Well, I'm trying to keeping it in the limited realm of home remedies. I have to limit it to food and spices and herbs, and then I'll give out a few of the variations for that can be used. For example, cough. You can't say, if somebody says, I have a cough, what's the home remedy? Well, my first question is it a dry cough or is it a wet cough? Do you have phlegm? Do you have mucus? Or do you have dry, hoarse throat? So it's a vast difference there, and that will dictate right off the bat what type of home remedy. for example, for a cough, if it's a dry cough, then often even warm milk with turmeric and ginger is very effective. But for a wet cough with phlegm and mucus and congestion, then honey with ginger, or honey with a little ground up clove, or even ginger, cumin, and clove tea to break up the congestion. And of course, you can put drops of eucalyptus oil in that too, or inhale eucalyptus oil directly to break down the mucus in the upper respiratory tract. And that wouldn't be necessary in a dry cough, where you're going to want something that's more of a demuculant and soothe the respiratory tract, like milk.
Demuculant. I like that word, demuculant. I don't think I've ever used that before. Kabir, before we move into these things, I just want to ask the question. Somebody comes to me or another physician, they usually come with a symptom or a set of symptoms, and we ask many questions. Just like you alluded to a moment ago, dry cough, we would ask, when did it start? Have you ever had this before? Is it accompanying a fever? Many, many different questions. And I know that you, in your Ayurvedic practice, sit down with someone also. You don't just say, you have a cough, okay, here. You start asking many questions. So before people start actually taking a home remedy, should they go through their own process of asking themselves certain questions with whatever the symptom or whatever they're trying to use the remedy for?
Yeah, of course. Ayurveda is based to a large degree on self-care, learning about your own distinct digestive system, body type, prakriti, vikriti, and then only with that knowledge would you be able to give yourself the right treatment or home remedy in this case. So it's very important to understand yourself and to understand your condition and not generalize. When people say, I'm sick, what does that mean? It doesn't really mean anything from a professional point of view, as you would say, or even I have a cough, or it's just not specific enough. So people need to understand the details of their own condition. And then, of course, evaluate and question what they may be doing in their daily life. Back to the wet cough or mucus or upper respiratory congestion, obviously you wouldn't want to be taking any dairy products during that period, which would only exacerbate it. But if you had a dry cough, that warm, raw, organic milk would actually be soothing and comforting. So it's very important to understand yourself and to understand what actions that you may be taking in your life or foods you may be eating to exacerbate or bring about this condition in the first place.
I like that idea. We always on Magical Medical Tour and Trinity of Life, we talk about lifestyle all the time, and that's an important part of any disease and any aspect of signs and symptoms. So let's get into it. And as we go through some things, I'm sure there'll be many questions Christina might have or I might have, and some comments that we'll want to make. So let's just pick something to begin with. How about one of the things that we see in our society today is people have trouble with sleep. So do you have a home remedy for sleep?
Yeah. In fact, the herbal formulas really are the best for sleep. I'll give out a few home remedies, but they're limited in their effect compared to herbs. The valerian root, passion flower, kava kava, just to name the Western herbs, and the Ayurvedic herbs, Shankta Pushpi, Tagar, and others are very effective and have the capacity to knock a person out and get them to sleep. So herbs really are the best solution for somebody with insomnia. But a nice home remedy is just a warm milk with a pinch of nutmeg. Nutmeg is a type of sedative, and in fact, I put it in some of my herbal formulas as well, powdered nutmeg. But an old home remedy is warm, raw, organic milk warmed up with 2 or 3 pinches of a nutmeg. And nutmeg has a delayed sedative effect that keeps you asleep. And that home remedy will work for mild insomnia. It works very well for children. But people who have chronic insomnia, or they're overthinking, overactive mind, high levels of stress, they're going to respond much better to herbal sedatives and nervines.
Okay, and again, I think that sleep is extremely important, but one of the things that's important always is, and I'll probably say this with almost each one of our remedies, is that if it works for you and you're having to take it all the time, you may want to start looking at lifestyle changes. But if it's not working, then you need to go see a specialist to maybe figure out something else that is the cause.
Yeah, and in the case of insomnia, your whole environment and your lifestyle is more than likely a major factor. Watching TV, overexposure to electromagnetic frequencies in your bedroom, a box spring mattress that has electromagnetic currency in it, current, electronic appliances in the room, flashing lights in the room. All of these have a big impact. And of course, the amount of stress and anxiety a person experiences during the day. But another good home remedy I'd like to bring up is acne, because this is one that's very effective by itself, and a lot of people do have it. And of course, there's many causes to acne: a poor digestion, a colon congestion or constipation, hormonal changes for both men and women. But just as a topical type of cure that someone can use, rinsing, washing first with a soap with a little tea tree oil in it because of its antimicrobial qualities is a good first step. Then a quick rinse, or like a toner, with either witch hazel oil or just water with a little lemon juice in it, or even just a teaspoon of apple cider vinegar, which has an astringent effect, which helps to pull the skin together. And then once you have maybe a particular pimple or spot you want to cover, a very effective home remedy is honey with a little cinnamon. So you take a little honey, raw honey, and put some cinnamon in it and mix it up and just dab that on the actual whiteheads. And this will, because of honey's viral, antimicrobial properties, and cinnamons, this is a very effective home remedy.
Kabir, this is important, and I think that all of us, just because they're home remedies and they may be around the house, when you're using them as a medication, I think it's very important to have special good high-grade qualities of these things. We talk about different honeys. You can have certain honeys that may not be good for you, and you have Manuka honey that might be excellent. Also, tea tree oil. There are some problems we've seen with, I think, endocrine receptor disorders and tea tree oil. So it's very important, again, to make sure the high-quality grades and some of these things more specific in terms of you're using them for healing now, not just for flavoring your drink.
Yeah, it's true. Culinary spices tend to be a different grade than therapeutic grade spices. Even when you buy certain spices, or like turmeric, there's different qualities that you can purchase. And the culinary ones in cooking tend to be the more lower grade. So you want to take that into consideration, that the turmeric you have in your kitchen may not be as good as the turmeric that's used by an herbalist, for example. Yeah, that's a good point.
So how do people, just in general, as we move forward throughout today's home remedies, how do people make sure that if they're going to use something as a home remedy, that they find it in the right place?
Well, first is buy the highest possible quality you can, or organic products. And if you have a choice between a lower grade product and a higher grade product, particularly when choosing spices or herbs, then you want to choose a higher grade. And many of these home remedies include honey. Honey is very useful. And of course, when I refer to honey, I'm only referring to raw, natural honey. I'm not referring to something you'd buy at the supermarket that's been diluted down with sugar.
Or comes in the shape of an animal.
Yes. Another good home remedy, which is more of a home treatment, is for allergies and asthma to some degree, and it's a vamana, or a therapeutic throwing up, or therapeutic vomiting. It's not too popular with people when they first hear about it, but the effects are very, very effective, and it's not very difficult to do. Basically, this is good for, it's a releasing what we would say in Ayurveda, all kapha problems, upper respiratory congestion, nasal blockage, asthma, allergies, that whole area in there. I do this treatment with the clients, and I don't do it in my office. I give them the instructions, and I give them the what necessary ingredients, and they go home and do it. And the results are always impressive every single time. And I've had people who've had asthma, for example, for years and years, and do this treatment and get back to me years later and tell me that they just do this therapeutic vomiting maybe 2-3 times a year, particularly in the spring, and that has resolved their whole asthma condition, which they had struggled with their entire lives. So this is a real a winner of a treatment. And it is one, it's probably better to have somebody guide you through, but it's not, once you've done it once, it's not very tricky. Generally, just make a cup of, or 3 cups of licorice tea. We just need some licorice root, boil it just like you would ginger, and strain it. And then drink about 3 cups of this licorice tea, warm. And then, and that won't make you feel like vomiting initially, but then you have start guzzling a pint or 3 or 4 cups of salt water with a teaspoon of salt, and this will start to make you feel a little nauseated, and then you just use your finger in the back of your throat and bend over in a chair into a bucket, and you'll throw up a few times or vomit, and this is very effective.
Boy, I would say effective, but I would also say very scary for me when I think of that. First of all, I don't know anyone. Well, there's a few groups of people that do like to vomit, but for the most part, I don't think many of us like to. But I would also warn people that just the actual regurgitation process, or the reverse of the normal peristalsis of the body, which moves things from the mouth to the rectum going in a different direction, you can actually cause anatomical damage in the area of the stomach and the esophagus. So this is one where I think that it would be very important to not do it often, as you said, maybe 3 times a year if you're going to do that. But I would also do it with the idea that you're going to be working with someone, because damage can occur from this. Not necessarily the remedy itself that you're mentioning, but from just induced vomiting many times. So I would want to be careful with that, although it sounds like if you could cure asthma, that's certainly worthy of consideration.
Yeah, it's a very ancient practice, and that's why the licorice tea is to soothe the whole respiratory area and prepare for it.
But in the part that I have the interesting dichotomy with is that the stomach is part of the gastrointestinal system, and the lungs and sinuses are more of the respiratory system. So I don't totally follow the way that it works, but I will assume, since I am not Ayurvedic, that there is some kind of an effect that happens there. But I don't necessarily follow the gastrointestinal part going into the respiratory part.
That's a good point. What it is the excess mucosa in the stomach, which that's the source of this phlegm and mucus. This is why we have the phlegm in the morning, is because it's coming up from the esophagus while we're sleeping, and then getting into our respiratory system. But the source is coming from the stomach, and this is where that phlegm and congestion is. And this is also creating a low appetite, poor digestion in the stomach. So generally afterwards, the appetite increases. But I'm happy to.
Yeah, no, this is really interesting for me because, you know, I really suffered from asthma as a child. And that's something that the Chinese doctor told me when I was a teenager too, that it's coming from your stomach. And honestly, that whole business of throwing up actually made me feel so good.
Oh, you did it,
But
huh?
I think it was a different form. It was like the salt water. That's why when you mentioned it, my whole body went, "Ugh," the salt water, you know. We didn't do it with licorice. It was a different Chinese tea that he had
Mm-hmm.
concocted. And yes, and that tea itself made us feel nauseous. And it was on an empty stomach, of course. It was when the
Mm-hmm.
stomach was empty. And so it was nothing else, but there was a lot of, I would assume, yes, that it was like a mucus that came up with it. Even though we're drinking the tea, it was almost like the tea was just gathering the mucus to come up. And it was quite a interesting feeling because it wasn't often. I mean, this was like twice a year that he would put me
Yes.
on this. And I mean, I don't suffer from asthma today, but that's also because of change in lifestyle. You know, there was a big change in lifestyle. So
A good point there on an empty stomach early in the morning. And in fact, most of these home remedies, particularly treatments, is that the trick is in the details. Admittedly, you can get one detail wrong, and it may not be effective. But another good area that people are always asking me about home remedies is constipation. And one of my favorite and most effective, which is in Ayurvedic, is a tridoshic, which means it's suitable for all three doshas, is castor oil. And really, the only, none of my home remedies taste that good, unfortunately. And castor oil, if you've had it much, is not tasty. And the real trick is just the quantity in which you take it, and of course how you take it. And so, for somebody with very mild constipation, maybe just not regular every day, even 1 tablespoon would be sufficient. And somebody with more chronic constipation, as much as 3 or 4 tablespoons or an ounce. And the trick is to make a ginger tea first, and then strain the ginger out, and then put the castor oil in the ginger tea, whip it with a fork, and then toss it down. And the ginger, of course, helps with the nausea and the taste, and helps being warm helps it to go down. And for some people, this works best early in the morning, and then others you can do it late at night, but it's very effective. Other home remedies for constipation are just prune juice, 5 or 6 soaked prunes in the afternoon. Very good for fiber. Of course, is important, but not always the case. And for many people, if they add more fiber, they're just going to become constipated. It really depends on the analysis of the person's stool. But oatmeal with ground flax, for those who have thin bowel movements and their constipation has been determined to be due to low fiber. It can't be a dry constipation, or you can make your constipation worse by adding more fiber. And for mild cases, then just even a warm milk at night with 2 or 3 teaspoons of ghee will help, particularly for the pitta type. And in fact, those 3 remedies that I just mentioned there, the are for Vata, Pitta, and Kapha, the castor oil being the best for the Kapha. I'm sorry, for the Vata with the dry, hard constipation, and the oatmeal suitable for the Kapha, and the milk and ghee suitable for the Pitta, who generally doesn't have much constipation. So those are all very effective. But herbs, again, are far more effective than all of these home remedies, particularly for the case of constipation. It's much easier to measure out an herbal formula in teaspoons or cups of tea than it is these home remedies, with the exception of castor oil.
Do they make the castor oil in gel caps now?
Hey,
that would be a great industry, you know.
That's why the trick is to take it with the ginger tea. You can't. Taking it straight is tough. I did it for years until I learned this little trick to make it with ginger tea and then chase it down with a little bit more ginger tea, and that makes all the difference.
Yeah, because that oil floats, man. That
Tastes
oil
terrible.
floats on
Tastes
that
terrible.
surface. Oh, yeah.
Well, I want to add a few things here. First of all, I think I mentioned this in a prior show. I went to see an Ayurvedic practitioner, and they had suggested castor oils. So, of course, I went hardcore and just did it, straight. And I did it for years. And after a while, you get okay with the taste. But it worked. And it wasn't actually, they didn't give it to me for constipation. They gave it to me for low back pain, which it seemed to help for some reason. I was not ever quite sure why it helped. Maybe it was a placebo effect. Maybe it did some other things, but I did it and it was good. But I would also want to bring up here again the importance of a few things. Constipation, the first thing that people should think about when you're getting constipated is maybe what you just ate, or you're, again, going to lifestyle. So if you can start finding foods that specifically after eating them cause constipation, it might be a good idea to eat less of those food or avoid it and find something else. The second part is that if you continue to have constipation, I think it's important to get it evaluated, because there are many serious disorders that can start with a simple symptom or sign of constipation. And the last thing I would say, and you've brought this up in terms of amounts and how much to put into each formula, when I've seen people that have come out of surgeries or have done certain things where they were constipated, they will take large doses of either over-the-counter medication specifically for constipation, or they will start taking large amounts of prunes or home remedies. I think it's very careful, because you don't want to go from constipation to diarrhea. So it's very important to be sort of moderate in your process until you get a real handle on how effectively things work for you as a remedy.
Yes, good point. And while we're on that subject of constipation, even a safer home remedy is really just enema bag. 2 quarts of water with a teaspoon of salt. This is much faster, safer. I've administered enemas to young children who have fevers and constipation, and it's really the safest way to break it up. And castor oil is never meant to use on a long-term basis. And yes, it is used in a lot of other treatments, including a gout, rheumatoid arthritis, lower back pain, and it tends to be very effective. And in those cases, it's usually just a small amount every night, like 1 teaspoon every night for those type of conditions.
Correct. So let's stay in the gastrointestinal area for a little while. Gas and bloating.
A great one, yeah.
People get that as symptoms. What's your remedy?
Yeah, well, there's and again, there's many different types of gas and bloating, because there's many different causes of gas and bloating or flatulence. And we can just start with gas. I mean, you've got stinky gas and you've got non-stinky gas, and you've got gas that's caused just from bad food combining. You've got gas that's caused by having fruit with a meal. So we're not really addressing the cause here, but we can say that there's many, many home remedies that can be done, and it does depend on the cause which one works for you. But one of the simplest is just a peppermint tea with ginger. That's probably one of the simplest. I have a little tea that I sell called Happy Belly Tea, and it's got the carminative herbs in it, ginger, coriander, and cumin, and peppermint. And this is very effective. Instant relief for most people. And during a meal, if they sip that hot during the meal, that will help. And the real trick is to adjust it for the individual. Say a kapha type, we can put in more ginger. For the vata type, who's most susceptible to gas and bloating, we put in more cumin. And for the pitta type, who has a little bit more heat and more heartburn types, heartburn accompany this gas, fennel So another good home remedy that was promoted for years by Dr. Vasant Lad is cumin, coriander, and fennel tea. So this is considered a digestive aid. And basically that should take cumin seeds, coriander seeds, and fennel seeds and dry roast them in a frying pan until the oil starts to come out, and then grind them down in a mortar and pedestal, and then have 1 teaspoon in a cup of tea. That's very effective. But in fact, you could just chew on a little ginger after a meal. You could just make ginger tea and sip it after a meal. These are be very effective. And if you go to an Indian restaurant, when you go out the door, they often have a fennel seeds at the door. So just chewing on fennel is very effective. So ginger, cumin, and fennel and coriander are these carminative herbs that are very, very effective. And it's really just picking the right combination of them for the individual. And if you throw them all in peppermint tea, then you have a very nice little formula that would be tridoshic and suitable for all types.
You know, Kabir, you've mentioned a number of times now the different body types, the Pitta, the Kapha, and the Vata. And I would suggest to anybody listening to this show that they go back to some of the other shows where you explain them in great detail. We want to spend more of our time right now on the remedies rather than going into the different body types, but really take some time or at least do some research on that, and maybe you can figure out a little more of what we're talking about when we're mentioning these. But in many of our prior episodes with Kabir, he does explain them in great detail. So I would suggest that. You did mention something that I really like, the concept of food combining causing the potential for gas and bloating. And I think that this is one of the areas that we talk about. We've talked about with Tracy Harrison. We've talked about with you in the past. And in terms of when you eat, whatever you eat, look for signs and symptoms afterward. If you have none and you're feeling fine afterwards, that's good. But if you start noticing that you're getting bloated or having indigestion or things like that, start keeping maybe a food journal for a short amount of time to see some of these things. And it might not be the food itself, but it might be combinations of foods which are preventing good digestion from the enzymes in the pancreas and the gallbladder and in the stomach and in the mouth. So that's an important part to look for.
Good point.
Christina, any thoughts so far?
I
You're mixing all your teas right now?
Oh, this is so much fun. I love this gas and bloating and constipation area.
These are all vata conditions.
It's like amazing because this these symptoms affect everyone from little babies and children all the way to the elderly, doesn't it? And it really is quite amazing. We can't run away from it.
Well, drinking that cumin, coriander, and fennel tea in between meals will not only help with gas, bloating, but help with improving digestion, improving the absorption of nutrients, and it's very effective. Cumin is probably the most effective spice in helping with gas, particularly for the Vata type. And in fact, just cooking your rice and putting in a teaspoon of cumin will help. And of course, as Hispanics know in South America, cooking with cumin helps to reduce down the gas in most legumes as well. So, cooking with these spices also has been known throughout history to help to avoid the gas that can result from some legumes. I have another good one, though, bug bites, bugs and stings. And this is one I've taught my son, and he's apparently helped out a few kids at school. And there's different approaches, but basically you need a drawing substance, something that's going to draw it out. Clay is probably the best. So, I do have some clay, and you can, mix certain herbs and even antiviral, antimicrobial, antifungal herbs with the clay, like even tea tree oil and things. But just clay by itself, a little moist, and then put on it charcoal or ash is, as we talked about before the show, activated charcoal. This also works. And if you have nothing else, then you can actually just take some dirt and mix it with a little water, which is what my son did at school, and just kind of pack it on and then put it in the sun. And as it dries, it has a drawing effect and helps pull out the what was been inserted through the bee sting. So that's a nice little a home remedy that is very
that is
effective.
good.
And people are surprised, and apparently my son has put some mud on some his friends who got bit by bees, and they were all very surprised. My son has also used charcoal. We were talking about charcoal. If you have a sprain or you sprain your ankle, my son has sprained his ankle, and I have people come to me with these type of sprains. And even though these type of acute conditions are not what I specialize in, I will give them some charcoal and send them home. And it's very amazing. You can get the charcoal and just put some water in to make it kind of muddy, and then pack it on your ankle or even a stub toe, and just wrap it all up, and then put something over it so it doesn't come out, and sleep on it. And by morning, your sprain will improve. Your stub toe won't hurt even after an hour. Even an abscess in the tooth or a swelling in the tooth, you can pack charcoal in there. So charcoal is really a great home remedy. And in fact, when I go camping or horseback riding, I always take a little bit with me due to its other many benefits about helping with the food poisoning, acid reflux, and it stops external bleeding too. So charcoal is just an amazing substance. And you can get charcoal from coconut, you can get charcoal or ash from cotton. There's many different types of charcoal. And of course, Ayurveda has many many different ways to use charcoal, but that's a very good home remedy and something everybody should carry with them in a home first aid kit or when they go camping.
I think we should consider interviewing your son. It sounds like he's got his own little practice going.
Oh, yeah, we have a little a baby in the house, a guest who has a 2-year-old baby, and he hurts himself all the time, and I send my son to go take care of him, and they go into the bathroom, and the kid comes off with little bandages and patches,
charcoal all over him. He's covered in charcoal. Has an enema bag
on him and everything else. And my son just, I guess, just learned from me applying to him for so many years. Now he's doing the same thing with little babies. So,
but I mean, how great is that? Because I mean, it's non-toxic. So,
yeah.
and it's black, and you know how kids love to touch things that are dirty, right? And they love to put it in their mouth. Well, it's completely safe. It's great.
Yeah, it's very effective.
You haven't taught him about the enema bag yet, have you?
Oh, he's had enemas even at an early age. I always want a child to be comfortable with an enema at an early age, so when they do have an acute condition like fever in particular or constipation, then they're already familiar with the procedure. And one time I went on vacation and I came back and somebody was taking care of my son, and they said he was constipated. They didn't say he was constipated. They said he had a fever. They were thinking, of course, taking him to the doctor. They didn't know what to do. And I just came in their house because I was going to pick up my son. I brought my enema bag. I took the kid in the bathroom. He was limp in my arms, just like lying there. His fever, he was sweating. And I had questioned actually my son on the phone before I got there. And I said, "Did you have a doo-doo today?" He said he knows how to answer these questions. He's not a kid that says he doesn't know. He's been asked his whole life about his bowel movements. So he gave me the whole report, and he basically told me he had one for a few days.
Wow.
So I knew the problem right there. And of course, he was in another environment where he wasn't getting food that was suitable for him. And I knew he had this tendency for constipation. So I went in and gave him the enema in the people's bathroom with a little salt. And I gave him the enema on the toilet. when I was done and all the, he was cleaned out, I was washing the enema bag in the sink, and I heard his voice behind me, perked right up and said, "Hey, Daddy, when are we going home?" And just 5 minutes earlier, he was limp as a fish, lying in my arms, sweating, looked totally exhausted. And after the enema, he walked right out of the bathroom, and it was full of energy that night. I couldn't even get him to sleep. So that's a type of case where enema can be very helpful. And often these children get fevers due to constipation, and adults do too. We just don't acknowledge it as much.
I have a number of other categories that I want to go in. I want to stay on the skin for one more minute.
Okay.
Burns.
Burns.
Superficial burns, maybe first, second degree at the most, not third or fourth degree. But what do you do for burns?
Of course, first of always, Ayurveda always practices the opposites, applying the opposite treatment. So, when you have heat or even whether it's any type of heat, then there's the opposite. So cold water, as we know, submerging the burn in cold water, even ice water, initially just to bring down the heat. And then the home remedy is basically aloe. And while you've got it in the cold water, then you tell somebody to get the aloe vera, and then you mix turmeric, maybe with a cup of aloe vera. You put maybe 1 teaspoon of turmeric in it, and let it. It's better it sits for an hour or two. You may not have that much time when somebody's in pain, but generally it's better to leave them in the cold water until the pain subsides, and then when the pain subsides, cover it with the aloe, with the turmeric.
I would add one part to that, just from the knowledge that I have in medicine. We used to do the same thing when people would come in with a burn into the emergency department. We would ice it down at first to get, thinking in the same line. But what we saw was that you have normal skin, which has, say, a normal temperature of 98.6 or somewhere around that. And when you have skin that's been burned, it goes up to a higher temperature, might be 101, 102, or something higher than that. If you put ice on them right away, it's that temperature change that sometimes causes the problem. So we started going from ice water or ice baths into more of a tepid solution to still bring the temperature down, but not to bring it down to an icy level, because as we all know, if you just put someone in ice normally, they could also develop problems with their skin and get burns from ice, hypothermia, etc. So we went to tepid water, but then the other parts of the solution that you're talking about, the aloe and the turmeric, that sounds pretty good.
Yes. Yeah, I don't think the Indians in southern India had much ice, so I think they just were going for the cool water. Probably is all they really had to work with.
Yeah, I think that's good.
Yes.
We're coming close to the end, Kabir, and I wanted to ask you. Of course, we're going to ask you for a health tip. You know that more than anyone now on the show. But I wanted to ask about toothpaste. Do you use regular toothpaste? We're reading a lot of articles nowadays on all of these chemicals that are in some of the normal toothpaste that are actually causing serious problems for people. And more people are going to natural toothpastes. So I wondered, I see people using sodium bicarb or baking soda and just using salt and water. What do you use?
Right now, a licorice root.
Well, traditionally, it was sticks were all used before they invented the toothbrush. I got my one end here, and then I got my more in between the cracks end here. So, there's many different tea tree oil, licorice sticks. There's different sticks that can be used. But it's very easy, and this is very effective in cleaning the teeth, because there's antimicrobial properties right in the stick, particularly a tea tree oil stick. So this is preventing infection, helping to protect the gums, and it's not as hard and abrasive as toothbrush. I think many of the toothbrushes that we use are too hard and too abrasive, particularly electric toothbrushes are too abrasive for daily use. And I agree that toothpaste is most of the common brands have fluoride, and and other ingredients which we don't really need. I've always made my own toothpaste, and I've modified it over the years, and often I give it out for Christmas presents. It's very cheap. Maybe I'm a little cheap, but because it's very cheap to make. But people seem to like it, and it's my main ingredients are charcoal. Charcoal is very good at cleaning the teeth. Baking soda is too abrasive, and I use it maybe only once or twice a month. And maybe before I'm on a video or interview with you, I may use it a little bit to, clean the teeth. But on a daily basis, it's too abrasive. So generally, I use charcoal as a base. Here's my little tooth powder container here that my son made for me to put my toothpaste in, or tooth powder. And so I use charcoal as a base, and then I put in maybe 10% salt. Salt's very good at cleansing the teeth, and actually for just good oral hygiene, brushing your teeth with salt, particularly if you have any type of infection, a toothache, then my protocol is first brush the teeth with pure salt to just disinfect the whole mouth and clean out with a toothpick any gaps or any holes where the tooth may be cracked or the actual cavity exists. And then in the cavity, you may have to have somebody help you do it, is put 1 drop of clove oil straight in the cavity. This will disinfect it and literally burn the nerve so you won't feel any pain. And then you can pack some charcoal around it. So that's the bonus home remedy there. But back to toothpaste. So I put the salt in here and cinnamon. Again, cinnamon powder. It improves the taste a lot. And just a little bit of neem. Neem is very, very good for the gums. In fact, for gingivitis and other types of gum disease, we can massage neem oil on the gums. But neem is very good for skin and many types of skin conditions. And of course, it's a very strong antimicrobial properties. So mostly it's charcoal with a little salt, cinnamon, and just a touch of neem in a powder form. Very, very effective. It makes your teeth all black. You spit it out, the sink gets all black. So generally you have to rinse. So then I follow it up with my own little rinse, which I make in these little bottles. And I just put, again, distilled water with salt and a few drops of tea tree oil and maybe a couple drops of clove oil, and then rinse a few times with that afterwards. And then the third step for oral hygiene, since we're kind of going in that direction here, is my final tip. Then do oil pulling, where you take a big gulp of sesame oil and hold it in your mouth and move it between your gums for 5 or 10 minutes and pull it between the teeth, and then spit that out and then clean the tongue off. So the oil will, sesame oil in particular is very high, we know, in minerals, particularly calcium, very good for the bones and strengthening the teeth. It's very nutritious. So this will all absorb and strengthen the bones in that area, and the oil protects it. So it's the brushing with the charcoal, neem, salt, and cinnamon, then the rinsing with the salt water, maybe with a little tea tree oil, and then the oil pulling. If you follow those 3 steps every single day, twice a day, or after every meal, you'll have very few dental problems in your life. And in fact, I've rarely been to a dentist, and I've practiced this my whole life, and I've only lost 1 tooth.
That's very good. For those people that are still hoping that this is a show about home improvement, do you have anything that would clean the bathroom after you've rinsed your mouth out with all that charcoal and clove and everything?
Tea tree oil.
Vinegar. Vinegar, in fact, is one of the nicest cleaning formulas that you can have. And we buy it in 99-cent store in the big gallon jugs. And after I wash down the sink or bathtub, I always just pour vinegar all over everything and pour it in the drain. It gets rid of the smell. It's a mild disinfectant. And you can pour it on the countertops, and the pets or children can touch it. And you won't have to worry as much as you would as using something as toxic as a bleach.
Mm-hmm.
We're talking with Kabir Southwick, our naturopath, our Ayurvedic healthcare practitioner, and herbalist. Kabir, you know more than anyone that we always ask for a health tip at the end of the show. And although you've given us many, do you have anything for us today?
How, besides carry your enema bag wherever you go? Okay,
I think that covers it.
Don't travel without an enema bag. I mean,
you have a special bag for your enema bag?
Have it in your bag. You never know when you're going to need it.
That's part of your first aid kit, huh?
It's part of the first aid travel kit, yeah.
You wear that around your neck or on your belt when you're traveling?
Well, you can't forget the salt.
Yeah,
charcoal, salt, enema bag.
Charcoal, salt, and enema bag. Those would be very important ones to take, yeah.
So I would like to thank all of my healers and my teachers for allowing me to be on my journey. Thanking Christina and YogaHub and Segovia and all of the team that worked to make Magical Medical Tour a great show. I would like to thank everyone for listening, and I look forward to seeing everyone next week as we explore another quadrant of the healthcare galaxy. Thank you very much, Kabir. And until next meeting, I wish you all optimal health.
Thank you for having me. Thank you, Glenn. Thank you, Christina. It's been a pleasure.
Thank you so much, Kabir. Another fun show with you and our wonderful Dr. Woolman there. Yes. We always have such good laughs on these shows. And yes, yet we're learning so much at the same time. It's fabulous. And of course, we'd like to thank each and every one of you for joining us in this new platform of education and information. We're always grateful for your continuous support, and we look forward to hearing your feedback on how we can serve you better. If you'd like to connect with Kabir Southwick and his wonderful work, please contact him through his website at naturalhealingwest.com. naturalhealingwest.com. And of course, you can connect with Dr. Glenn Woolman through his website, glennwoolman.com, where I encourage you to learn about his metaphor square breath. And again, we are always grateful for any feedback, comments, or suggestions that you might have. Please give us a call at 818-LETS-TALK. 818-LETS-TALK. And until next time, namaste.
How Tibetan medicine talk about the origin or the cause or the source of human body is, human mind is. Because in school medicine, you say where your body comes from, the zygote, the sperm, the ovum, and all this thing. But when we trace and when we try to look into where your mind comes from, then you're lost. So we tell them clearly. We tell them clearly how Tibetan medicine tells where you are born, how your physical body comes from the previous continent.